In 2017, long before formal funding, institutional partnership, or international recognition, members of the Slum and Rural Health Initiative, SHRIM, began engaging with people living in underserved communities and also internally displaced people living in migrant camps affected by conflict in northern Nigeria. At that time, mental health services were nearly non-existent within many humanitarian settings in Nigeria, even though trauma, grief, anxiety, fear, depression, and emotional distress were widespread among children, adolescents, and families displaced by violence. We began with human connection because we believe in the power of a positive social contact. We organized football matches, storytelling activities, group discussion, games, recreational therapy sessions, and peer support conversations and psychosocial engagement activities for both male and female participants within the migrant camps. And what appeared simple on the surface was deeply intentional and personal. These activities became safe entry points into emotional healing and psychosocial support for young people living under the weight of displacement, depression, and conflict. Through these early interactions, we began observing the devastating psychological impact of insecurity and forced displacement. Many young people carry the weight of untreated trauma and emotional pain, while stigma surrounding mental health remained high in these communities. But through our interaction and social contact with these people, these experiences also made us realize that the solution to these challenges that these communities face were also within the communities, as the community were very eager to support one another, especially through their mental health challenges that young people face within the communities. We had community leaders who volunteered to be peer support leaders and community mental health counselors within the communities, and the community was very willing to co-create these solutions with the team at Slum and Rural Health Initiative. These experiences shaped these organizations' early understanding that mental health support in humanitarian settings needed to be community-centered, culturally grounded, trust-based, and accessible. The lessons from 2017 became the foundation upon which Slum and Rural Health Initiative's future mental health and psychosocial support system would later be built.
In 2018, Train's engagement within displacement communities deepened significantly. We continued interactions with children, adolescents, caregivers, and vulnerable families, and this revealed the true scale of psychological distress that affected the internally displaced populations that we were interested in working with. The young people there talk about fear, instability, disrupted education, poverty, loss of loved one, and the emotional toll of that prolonged conflict. During this period, although Shin was not officially registered yet, the individuals that will later make up the registered organization recognized that the normal, conventional, and traditional methods in the mental health system cannot adequately address the realities within these underserved communities. Many of these young people in these IDP camps were willing to engage through games like football, Ludo, storytelling, music, social interactions, and conversations, rather than through the formal counseling systems that work in traditional system. These realization and eye-opening discussions became a defining philosophical turning point for the organization, not a registered but teams of people. Mental interventions made us realize that mental interventions need to extend beyond clinical treatments, more into dignity restoration, because these young people have lost their dignity, gone through different traumatizing events. It also helped them build resilience, social connections, emotional safety, and community trust. These experiences shape Shuin's emerging vision of an humanitarian mental health system that will eventually combine psychosocial care, youth leadership, community ownership, and innovation. That's why innovation is one of the core values of what we do at Slum and Rights Initiative. Learning from these examples over time.
By 2019, psychosocial engagement activities had expanded. Volunteers and health professionals pooled personal resources to continue supporting displaced populations despite the absence of formal funding structures. Inside the camps, SHRIN continued implementing sport activities, emotional support sessions, mental health awareness discussions, community wellness education, and peer support engagement. However, beyond psychosocial care itself, SHRIN increasingly understood the broader societal implications of untreated trauma among displaced youth.
The team recognized that unresolved emotional distress, social exclusion, hopelessness, and lack of opportunity could expose vulnerable young people to exploitation, violence, instability, and radicalization. Mental health support therefore became linked not only to healthcare but also to peace building, social protection, resilience, and conflict prevention. This period also strengthens the organization's understanding of trust building within humanitarian settings. Through consistent engagement, communities gradually became more receptive to discussions surrounding mental health, emotional well-being, and psychosocial support. These relationships would later become essential for successful implementation of larger community mental health interventions.
In 2020, we entered a transformative phase. We gained experience from the field work within the IDP camps. We started engaging funders, remember, writing a lot of grant submissions, thinking and redefining the intervention model, seeking support for mental health and psychosocial support that works for people in this community. It was a long event. It took months and months of midnight work, writing. We got feedback from funders. Some funders did not give us feedback, but eventually I cannot forget that day and that experience. This led to a breakthrough. We got a transformative funding from Grant Challenges Canada and government-led partners that brought light to the onset or the birth of the Bravers project. For the first time, we were able to transition from a volunteer-led organization or a volunteer-held psychosocial support or family and friend support to an organization that was financially sustainable to be able to do that, leading to the launch of the transformational Brave Art project, an initiative that is designed, or an initiative that's addressing the mental health needs of internally displaced children and young people in IDP camps. The year 2020 was a transformational one, and it seems that the psychosocial support that we were giving was trying to forecast that there will be a pandemic where that type of psychosocial support will be needed.
In 2021, Slum and Rural Health Initiative formally launched the Brave Art Project, an innovative community-led mental health and psychosocial support intervention focused on displaced children and young people living in northern Nigeria. The project introduced a new model of humanitarian mental health care that combined task shifting, youth leadership, community advocacy, digital mental health systems, and art-based psychotherapy. One of the first major activities involved surveying internally displaced person camps to better understand the prevalence of depression, anxiety, trauma, and psychosocial distress among young people. The organization also trained community mental health therapists drawn directly from the affected communities themselves. This approach addressed workforce shortages, language barriers, cultural mistrust, and limited access to specialists while promoting sustainability and community ownership. One of the most groundbreaking developments during this year was the establishment of the Friendship Tent, described as the world's first solar-powered mental health center for displaced young persons. The friendship tent served as a safe therapeutic environment where children and adolescents could access emotional support, art therapy, psychosocial care, peer support systems, and mental health education in a welcoming and stigma-free setting. At the same time, the organization also advanced digital mental health efforts through the development of the Simbi Health application, integrating technology into humanitarian mental health delivery systems for underserved populations.
In 2022, the Brave Heart project moved fully into implementation. The systems developed during the previous year began operating actively within the displacement camps as trained community mental health therapists started delivering therapy, psychoeducation, and psychosocial support sessions, emotional wellness activities, and community mental health interventions directly to affected populations. This task-shifting model became one of the organization's most important innovations. Rather than depending exclusively on psychiatrists or highly specialized professionals, the project demonstrated that trained community members could safely and effectively provide structured psychosocial support under supervision within low-resource humanitarian settings. The Friendship Tent also became increasingly recognized as a trusted mental health hub within the camps. Young people who previously struggled silently with trauma and emotional distress now had access to safe spaces where they could express themselves, receive support, participate in group activities, and begin healing collectively. As implementation expanded, the project increasingly demonstrated that community-led mental health system could achieve meaningful impacts even in fragile and conflict-affected communities. In 2023, the organization entered a critical evidence generation and system strengthening phase. After several years of implementation, the Brave Heart project began demonstrating measurable mental health and psychosocial outcomes among displaced youth populations. The organization conducted evaluations to assess the effectiveness of its interventions and observed significant improvements in depression severity, anxiety outcomes, mental health literacy, trauma awareness, and psychosocial well-being among participants. Community acceptance of mental health intervention also increased substantially due to the project's culturally appropriate and youth-led implementation approach. Recognizing that emotional well-being was closely connected to economic stability and future opportunity, the organization integrated vocational training, entrepreneurship support, and digital skills development into its programming. This expansion strengthened resilience building while increasing community participation and long-term sustainability. The year also marked a major expansion in advocacy, partnerships, and visibility. The organization hosted dissemination conferences, strengthened collaboration with stakeholders, including International Organization for Migration and government institutions, and released My Safe Space, a documentary highlighting psychosocial healing and lived experiences of displaced youths. By 2023, the Brave Heart project had evolved beyond a localized intervention into an evidence-informed humanitarian mental health model, attracting broader institutional attention. In 2023, the organization entered a critical evidence generation and system strengthening phase. After several years of implementation, the Brave Heart project began demonstrating measurable mental health and psychosocial outcomes among displaced youth populations. The organization conducted evaluations to assess the effectiveness of its interventions and observed significant improvements in depression severity, anxiety outcomes, mental health literacy, trauma awareness, and psychosocial well-being among participants. Community acceptance of mental health interventions also increased substantially due to the project's culturally appropriate and youth-led implementation approach. Recognizing that emotional well-being was closely connected to economic stability and future opportunity, the organization integrated vocational training, entrepreneurship support, and digital skills development into its programming. This expansion strengthened resilience building while increasing community participation and long-term sustainability. The year also marked a major expansion in advocacy, partnerships, and visibility. The organization hosted dissemination conferences, strengthened collaboration with stakeholders, including International Organization for Migration and government institutions, and released My Safe Space, a documentary highlighting psychosocial healing in lived experiences of displaced youth. By 2023, the Brave Heart Project had evolved beyond a localized intervention into an evidence-based humanitarian mental health model attracting broader institutional attention.
In 2024, our work received increasing recognition from national and international institutions working within humanitarian health and mental health system strengthening. Teams from the World Health Organization and Nigeria's Federal Ministry of Health visited our IDP camps to observe the work of our community mental health therapists and evaluate the implementation of the Brave Heart model within humanitarian settings. This engagement reflected growing institutional recognition of our contribution to community-based mental health system strengthening in conflict-affected communities. During the same year, we also participated in specialized engagements organized by the World Health Organization Health and Migration Program, focusing on competency standards for health workers supporting refugees and migrants in Nigeria. These activities has positioned us within broader international conversations around migration health, humanitarian response, and psychosocial support systems. Additional support from partners including the Dovetail Impact Foundation and the Microsoft Give Back campaign further strengthened our infrastructure and sustainability efforts for mental health programming. In 2025, the Brave Heart Project continued expanding both in scale and international visibility. Our work was featured at major humanitarian and mental health platforms, including a United Nations General Assembly side event chaired by the MHPSS Collaborative. We also secured additional support from the European Union Global Youth Mobilization Initiative to strengthen ongoing humanitarian mental health interventions and community system strengthening efforts. One of the most innovative developments during this period was the launch of the 5G remote clinic project. Through collaborations with institutions including the University of Glasgow and mental health professionals across multiple countries, displaced young people with severe mental health conditions gained access to remote consultations and specialized care support from experts in Nigeria, the United Kingdom, and other regions. This initiative demonstrated our growing integration of digital innovation, international collaboration, and humanitarian mental health delivery. It also reinforced the principle that vulnerable populations living within displacement settings deserve access to quality mental health care, regardless of geographical barriers.
By 2026, STREAM's focus has shifted strongly towards sustainability, community, and long-term system strengthening. Rather than simply introducing temporary interventions, the emphasis became ensuring that the mental health structure already established within this community remained functional, scalable, and community-owned. With continued support from partners, collaborators, the organization expanded, retaining programs for community mental health therapists while training additional community members to strengthen local mental health capacity within displacement settings. Therapy delivery, psychosocial support activity, mental health education, and community-based intervention continue through the existing infrastructure built over these several years of implementation. The Friendship Tent remained an active, trusted space for healing, emotional support, and community engagement. What began years earlier as small volunteer-led psychosocial activity inside displacement camp had evolved into a recognized humanitarian mental health movement, contributing to community resilience, system strengthening, youth empowerment, digital innovation, and global conversation around mental health care in fragile settings.